Menopause is having a moment, and it's a wonderful moment for women. There's more exposure and more discussion, and women are going to their OB/GYN, their gynecologist, asking for education and care. Hormone replacement therapy, or now called menopause hormone therapy, MHT, is one piece of the puzzle and is the primary focus right now, and is wonderful because the black box warning that the FDA had placed on hormone replacement therapy has recently been lifted in many cases. And so now, providers are free to prescribe or are more comfortable prescribing menopause hormone therapy, and so it's more accessible. Although it is still hard to access for some people, and so a lot of the discussion around the menopause moment is around hormones. However, what I think is being missed and what we're not really talking about yet, which is why FamilyWell is coming out and providing resources around this, is the mental health component of perimenopause and menopause. The symptoms of these mood disorders that sort of either develop for the first time for women during this phase of life or recur if you've had symptoms of depression, anxiety, insomnia, et cetera, in the past. Um, it is so common. So as a clinician myself and someone who works with a lot of OB/GYN providers, the number one symptom that women come to their doctors talking about is I can't sleep, insomnia, depression, anxiety, brain fog. These are the most common symptoms. They're the most bothersome symptoms. And a lot of the discussion is around hormones, but hormones, it's just one piece of the puzzle, right? It's not a magic bullet. It's not going to fix everything. So you have to think about the mental health side and other non-hormonal therapies that can treat those symptoms and help make women feel better during this time in their life. So let me give you a really concrete example. Insomnia is one of the most common symptoms, right? I am actually going through this myself. I'm perimenopausal, and my friends and I, we joke around about the 2 a.m. club. So at 2 a.m., we're all awake for no reason. Sometimes you wake up because are having a hot flash, or sometimes you're just awake. And so it is very common, and it can affect, your mood, and it can have downstream effects, causing anxiety and depression. And so one of the most effective therapies for treating insomnia in perimenopause and menopause is CBTI. It's called cognitive behavioral therapy for insomnia. 8 sessions of CBTI can be really effective at supporting and treating those symptoms and helping you sleep better. And so that's not talked about in the menopause story right now, in the menopause moment. So combining the hormones with these other non medical treatments, excuse me, non-hormonal treatments can really help women have a comprehensive treatment, comprehensive view of how to move forward in this really difficult time in their lives. Perimenopausal depression, while not a diagnosis in the DSM currently, is thought to be um, is thought to overlap with major depressive disorder, but also have some unique features. So perimenopausal depression is partially hormonally driven because of the hormonal fluctuations in perimenopause and menopause. And so some of the symptoms that you see in perimenopausal depression are very similar to major depression, but are exacerbated sometimes by your period cycle, right? By your menstrual cycle. So some women who have perimenopausal depressive symptoms, their symptoms worsen before or after their periods uh, during menstruation. Um, Other examples, so perimenopausal depression oftentimes is subclinical. So while major depressive disorder has certain features, and clinicians in this field, they use the DSM to make that diagnosis. Women with perimenopausal depression may not meet those diagnostic criteria. So just because they don't meet it doesn't mean that the symptoms aren't bothersome and functionally in their lives. And so oftentimes those symptoms are subclinical but important to recognize and treat as well. And again, CBT can be a really effective therapy for treating perimenopausal depression. The other call out that I just want to make is that hormonal therapy is not FDA approved to treat perimenopausal depression currently. While I think hormones can definitely improve symptoms for some women, it's just important to keep in mind that it isn't FDA approved. Menopause Behavioral Health Certification Program is the first of its kind. It's a program that it's geared towards behavioral health providers. So that includes coaches, social workers, therapists, psychologists, and any other behavioral health providers, whether you're licensed or not. Um, the reason why we developed this is because there is just a lack of education around, as we've talked about, around behavioral health in the perimenopause and menopause phase of life. And clinicians are knocking on our door asking for certificate or for education around this topic. And so the MBHC prepares behavioral health providers to go out and practice clinically and support women going through this phase of their life. So it's 15 hours of asynchronous content taught by experts in the field, ranging from all topics from, how do you screen for behavioral health disorders in perimenopause and menopause? How do you triage? How do you think about treatment? How do you think about hormone therapy versus as compared to, other therapies? How do you think about menopause care holistically? So it affects every organ in your body. So how do you think about nutrition? How do you think about pelvic floor physical therapy? How do you think about all of these other aspects of menopause and perimenopause that women are experiencing and putting all the pieces of the puzzle together? And so 15 hours of asynchronous content plus 6 hours of mentorship. So they get practice with actual clinical cases, working through those cases with mentors who are leaders in the field, clinicians in the field. And then at the end of it, they get a certification and they can apply the continuing education credits, the CE credits, towards their licensure if they are licensed to maintain their licensure. Great question. So a lot of times women, in the past, I've heard anecdotally, a lot of women go to their doctor or go to a provider and they sort of get dismissed. That is a common feeling among women. You go to your doctor, I'm having these symptoms, you get dismissed, or you don't, or providers aren't actually thinking about these symptoms related to menopause or perimenopause. And the reason for that, I think, is because of lack of education and knowledge. And so what we're trying to do at FamilyWell is provide that educational opportunity to providers so that they are recognizing when the symptoms are related to perimenopause and menopause and providing the appropriate treatment options downstream. And then secondly, physicians also during medical training, residency, I never received any training, formalized training on menopause, or women's mental health at all, right? And so building this educational muscle and getting it out there to providers of all types in women's health, I think is number one. The other piece of this is that we aren't screening for mental health conditions in perimenopause and menopause. There is a wonderful evidence-based screener out there called the MRS, the Menopause Rating Scale, and we just aren't using it. And so we need to start using it. We need to start learning what the symptoms are and then figuring out how to get women care connected to care. I think that one piece that's really critical and missing is the peer support aspect and coaching. And so at FamilyWell, we really believe deeply in coaching as a mechanism to help support women, or a therapeutic modality to support women. And what coaching does is it provides women with somebody who has lived experience. So somebody who has gone through perimenopause or menopause and knows what to expect and can help support you in holistically in every aspect of your life. Because as I mentioned, menopause affects every organ in your body. A lot of women gain weight. A lot of women have skin changes, hair changes, genital urinary changes, decreased libido. It affects every organ in your body. And so to have somebody in your corner, a coach, who can tell you, what to expect, how to think about menopause and how to overcome some of the challenges, right? There's a lot of negativity around perimenopause and menopause, but it's just another one of those phases of our lives as a woman that personally I'm embracing and figuring out how to look at the positives and having that coach in your back pocket, just telling you that you can do this and you can get through this is so powerful. FamilyWell has written the first white paper that I am aware of, really highlighting how mental health conditions affect perimenopause, menopause, the pathophysiology, the need for screening, the need to think about holistic care, so hormones plus some of these additional non-hormonal therapies such as CBTI, how to think about perimenopausal depression as compared to major depressive disorder. And so that white paper really highlights that and gives clinicians in this space an overview of mental health in perimenopause and menopause.